Here's your host, Chelsea Edwards.
Welcome to another episode of Chattin with Chelsea. I'm your daytime bestie, Chelsea Edwards. Ladies, grab your fans. Yes. No, it's really not time for another line dance. We just may need a little help cooling off today because we are chatting about perimenopause. Yes, it is that interesting time before menopause where your hormones start breakdancing, and then those mood swings will have you wanting to fight your own kids. Let's just be honest, okay? So I know for a lot of you it sounds exaggerated. Perimenopause sounds made up, but there is science behind it, and we've got the experts in to help us figure it all out. And you spouses, you better listen up and pay attention.
We got some helpful advice for spouses of perimenopausal women. Don't ask me what's for dinner. My food aversion is so bad, if it's up to me, everybody's eating hard-boiled eggs. Don't chew so loud. Same goes for that nostril whistling thing. Stop that. If you can't find something, try looking for it before you ask me if I know where it is. Matter of fact, just don't ask me any questions. Don't touch that thermostat. If I have it set to 62 degrees, you leave it. Get a sleeping bag or something, you'll be fine. Want sex? Start the process 3 to 4 business days ahead of time. If you can spend 4 hours researching fantasy football picks, you can spend 10 minutes educating yourself on perimenopause. Because a lot of what we're going through isn't just physical, a lot of it is psychological. And it can get pretty dark sometimes. Just having somebody that gets it and can give a little bit of empathy goes a long way.
Now, I gotta give her a round of applause for that. I mean, I'm not perimenopausal, but I can relate to some of those regardless.
That was good.
Yes.
I can relate to pretty much all of it.
Okay. Welcome, Dr. Brandy Williams, pharmacist of 18 years and founder of We Care RX Pharmacy. Now, I know people are gonna think that you're just gonna talk about a lot of drugs and stuff here for perimenopause, but you talk about holistic things as well, solutions for some of those symptoms. But before we get into that, what is perimenopause? Because I feel like a lot of people had not even heard of this term until recently.
A lot of people only look at the term menopause, but perimenopause is the stage that you go through. It's pretty much your entire menopausal stage, because you're not actually menopausal until you've had 12 consecutive months without a menstrual cycle. It could start as early as 30 and extend well into your 50s, depending on your makeup. Yes.
So you can be perimenopausal for decades.
Decades. Yes.
Wow.
That is the process before, okay, I have arrived in a sense as a woman.
So how do we know we're perimenopausal?
So to be diagnosed in perimenopause, you need symptoms and you need lab work. So testing, hormonal tests. And they go together because their hormones could be normal, but hormones are in a range. So your progesterone, there's a range. Your testosterone, there's a range. Your estrogen, there's a range. So I could still be within normal range, but it's not my normal, if you understand what I'm saying.
Okay.
So then I'm like, you could be having all of these symptoms. You could be having the brain fog. You can be having the anxiety. You could be having the depression. You could be having the sleepless nights where I'm able to go to sleep, I'm not able to stay asleep, or I'm not able to go to sleep at all. You could be having night sweats. You could be having hot flashes throughout the day. You could be having vaginal dryness. You could be having vaginal atrophy. You could be having a high occurrence of UTIs.
Wow.
And it's all overlooked because I'm too young to be menopausal.
Right, or I think this one thing is not related to all these other things.
Correct.
Wow, okay, so where do we get the testing done? Let's start there. Do we need to go to our OBGYN, or can we just go get some lab work done?
So I would recommend there being a team. So you could get hormonal testing through me, but it won't be a blood test. It'll be an oral saliva test because your hormones are also detected in your saliva. So you could come to the pharmacy and you could get a saliva test. It would be something that you would do on your own. You would take the kit home, you would mail it back in, and then you would receive the results. And then I would have a conversation with you, and then I would pair with your OBGYN, and we would have a conversation together. So I think it is based on having a team. So the team would consist of you as an individual, as the patient, your OBGYN, as well as your pharmacist. I think it needs to be a collective effort to make sure that you are getting the health and the wellness that you need.
Okay, let me ask you this. How do we know when we're moving from perimenopause to menopause? Like, it's official.
It's not official until 12 months consecutive, 12 consecutive months without a menstrual. If I am on my 11th month not having a menstruation and then I start spotting, I start all over.
Oh, okay. You're still in
it.
Okay.
You're still in the thick of it, and you're still perimenopausal. Yeah. So you don't actually arrive. And then even with that, once you are 12 consecutive months without a cycle, you're menopausal. That doesn't mean that everything is clear, that everything goes away. Now it is even more important for you to really get those hormones tested to see where you are and to see where you need to be, because there's so much that goes into it. The lack of estrogen and progesterone has been linked to dementia and Alzheimer's, which is why it's higher in women. So all of this, even heart disease, is higher and more prominent in women, and it's because of going through this menopausal phase.
Wow. Okay, so I know you have some tips and suggestions for us to get our bodies functioning as they should, even during perimenopause. We're gonna take a quick break, and then we will be right back with those. You don't wanna miss this.
Hello and welcome to all new and existing members of the We Do Not Care Club. I started this club for all women in perimenopause, menopause, and postmenopause. Let's go ahead and get started with today's announcements. We do not care if we lose our train of thought in the middle of a sentence. We are tired of talking to you anyway. We do not care if you think we look pregnant. We're just flattered that you think we are still childbearing age.
Yes. So these are some things that people may not realize women deal with during perimenopause and after. All right, so Dr. Brandy, let's give some solutions, okay, to some of these symptoms. And I want to start with, she mentioned like the brain fog and, you know, not being able to finish a thought. Yes. So let's start up here. Let's start with the mind. Okay. What are some other things that women may experience, or is that generally it? And then how can we help that?
Yeah, the brain fog is really huge. I experience it a lot myself on a daily basis. So for that, I have been supplementing, as well as telling my patients to supplement with NAD. And NAD is something that our body naturally produces. Okay. So, but it's at its highest production when you're a child. It's a very sensitive peptide. Okay. So it can be done by an injection or either sublingually. And then there is just bone health, increasing your vitamin D. Increasing, yeah, it is really huge. People don't realize that bone health affects your teeth. Your teeth are bones.
Oh yeah. Yeah.
Your teeth are bones. So even when you're going through this perimenopause and this menopause stage, some people have tooth decay. And they don't realize, and they think, oh, it's because of my hygiene. Right. It could be an internal loss of vitamin D or osteoporosis. Women are at the highest rate of osteoporosis because of the loss of progesterone and estrogen, and because we're not doing anything to supplement that. And it's something that we overlook. But also magnesium. Magnesium is going to help with your gut health. Then she talked about that adipose tissue just lingering in the gut, like
asking if I'm pregnant, when I'm due.
I'm not pregnant, but I am perimenopausal, or I'm in menopause. For that, it is really, really hard to just naturally lose that weight, which is why we see so many older women per se with slender, but just that extra, with that. What do they call it? A fupa?
Yeah, with the fupa, the fat upper pelvic area. Yes.
With the fupa. So embrace the fupa, because it's not that they're lazy or that they're just overeating. It's because of a hormonal imbalance. So for that, GLP-1s,
Okay.
I am not opposed to it. A lot of people are opposed to it. Yes, it is something that helps with diabetes, and that's how the drug was discovered.
Okay.
But the drug does so much. It helps with the heart. It helps to protect the heart. It helps to helps with the cardio function, which is also diminishing because of your lack of estrogen production.
Let me ask you this: with the GLP-1s, we're talking about the weight loss injections. Will you have to continue taking those all the way through menopause? Is that something that you will need to keep doing?
It depends on the person and your actual makeup and how you're metabolizing the drug. But I will say that it will not be something that you would have to continue on for the extent of you being in menopause or perimenopausal. No, you pretty much, the drug works. It helps you to cut out the bad habits. It works on the gastric emptying time. So it makes you feel fuller longer because your food is not being metabolized at the high rate that it was metabolized without the drug.
Okay. So so that's one thing that we might get at the pharmacy to help with all these symptoms. Are there other things? I mean, we talked about the supplements, but are there other things out now that could help?
The bioidentical hormones.
Okay.
So people are usually afraid of hormones because of some early studies that were done, but they were done on synthetic hormones.
Okay, and they were talking about cancerous.
Yes.
That scares people.
Yes.
Okay.
Yes, but those are the synthetic hormones. The hormones that are being utilized now are bioidentical hormones, which means the chemical structure is similar and almost exact to the makeup of your testosterone that your body normally produces. It's not like a foreign object entering the body. The body's not fighting against the medication, and it decreases the side effects.
So that's something that we can talk to our doctors about, and you were saying like you want a team to help us through this.
Yes.
Okay.
Yes, it's gonna take a team because while your doctor can diagnose you with being perimenopausal or being in the menopausal stage, the treatment for it, they do know the treatment, but the intricate parts that about which hormones you should do or the difference between unless they study compounding or pharmaceutics, they may not be as knowledgeable about that. And so that's where the pharmacist comes in.
Okay, all right, sounds great. Like we need a whole party line and get it together.
Yeah.
Yes.
Yeah, and we need to stop being afraid to talk about it. So you said you're not perimenopausal. There are a lot of women who feel that way but are suffering from some of the symptoms and just don't know.
Okay, so
Don't know.
good time to have those conversations.
Yes.
All right, so we talked about the mind and parts of the body. We're gonna go a little lower, guys. We're gonna take a quick break. We'll be back with her down there. This clinic, the owner has a new book that's gonna help you down there, no matter what stage you're in. All right, we'll be back. We've been talking all things perimenopause, including how it affects different parts of the body. So now we're gonna go a little low with Letrice Mason, nurse practitioner, author, and owner of Her Down There. Hi. Welcome back to Chat with Chelsea.
Thank you for having me.
Okay, I gotta give you your props. Because you are an author now, you having a book out.
I'm so excited.
I am very excited to get into this.
Yes.
But first, since we were talking about perimenopause,
yes,
what are some things that women should be aware of when it comes to down below and how it can affect that part of your body?
Well, I would say one of the biggest things is vaginal dryness.
Okay.
And then once you're dry, then you don't want to have sex, and so it kind of affects your libido. And there are medications and creams and things that you can use and get from your provider that can help with the vaginal dryness so you can get back, your mojo.
Okay, do women hesitate to talk about that with you? Or?
Not with me.
Okay, then maybe with their partner.
Yes.
Yeah.
But I think they hesitate to talk about it with their girlfriends, even though we're all going through the same things at the same time.
Okay. All right. So great to know. So don't be shamed.
Yes.
And there's help out there.
Absolutely.
Okay, so let's get into Her Down There.
Okay.
A guide to keeping her healthy, happy, and hydrated.
Yes.
So you go beyond perimenopause.
Yes,
in
absolutely.
here. Okay, tell me a little bit about that.
So I kind of wanted to start with a whole array of things that most women are going through, whether you're 21 or you're 60. So I have a couple chapters that are about like BV and STDs and things that some of our younger individuals are dealing with.
Okay.
And then as we get a little older, you know, our body changes. So we go through a couple of things that go through menopause, perimenopause, PCOS, hormones, etc.
Ah, okay. So you're breaking it down by the
Yes.
different ages.
So something in there for everybody.
Okay, all right. Just a point here. Now the older ones, they've been in the streets lately, from what I hear.
They have.
So they need to read all the chapters.
All the chapters.
Okay.
Yes.
All right. Just want to make sure. What is one thing that women, I guess, don't really understand, or maybe a misconception about that part of their body in your experience?
I would say estrogen plays a huge role in our lives from beginning to end. And as we get older, it depletes and it changes your vaginal tissue, it changes your breasts, it changes your skin, it changes your bones and your heart. So I would say that women should pay attention to the different changes that are happening as they get older.
Okay, so if they are noticing some changes, is that a clue to call the doc, or do we just, okay, well, it's in the book, it's supposed to be normal, like what
The
are
book
the
is a good
steps?
place to start.
Okay.
However, you should then follow up with your provider because you want to make sure what you're going through is normal.
Ah, okay.
And you don't want to miss anything.
Okay.
Yeah.
All right, good to know. Any ideas on other things that may help, like diet and things like that, to help with these changes? Is that included as well?
Yes, it is.
Okay.
I like to I go through a whole array of things, starting with the types of soap that you should use, so non-fragrant soaps.
Okay.
That thongs are not your friend, bubble baths are not.
Thongs are our friend?
I mean, you
so
think
hard
about
to tell. They're just so comfortable. Just want to wear them every day.
that little string just doing this all day. No, thank you.
I just
It's an
love
easy
floss.
pathway
Yeah.
for pathogens and bacteria.
Yes.
No. Same thing with bubble baths and trying to reduce maybe a little bit of the dairy or sweets that we eat every day. And a big one that a lot of people don't think about is dryer sheets and softener.
Oh, wow.
The fragrance from that is the same thing we're trying to avoid in your soap. So imagine if you're doing, washing your panties in that, you kind of want to separate that from.
Oh my gosh,
Yeah.
that's such a good note.
Yeah.
Okay, let me run this part back.
Okay.
Dairy. Now,
Yes.
I've heard of this before, but I haven't actually heard anyone expound upon that.
So a lot of it has to do with your gut health. So the
Okay.
same flora that's in your gut is the same flora that's in your vagina. So everything that you consume and you eat, your body has to process that. And when you put things in your body that create mucus, then now your body doesn't react the way it should. So now we're looking at bacterial vaginosis or yeast infections, UTIs, etc. Yeah.
Okay, good point. Okay,
Yeah.
another
I'm not
note.
saying you can't have no dairy.
Okay, all right.
Just, minimize.
Okay, watch what you
Yes.
intake. Okay, got it.
Yeah.
Do you feel like part of the reason that you wanted to write this book is sometimes we don't have these conversations, like full-blown women.
Yes.
We've never had these conversations with our friends or with our mothers.
Right.
Anything like that. That's what you've run across.
That's really kind of one of the reasons why I wanted to write the book, that it's so taboo to even say the word vagina, like it's this scary, word.
Okay.
And because our grandmothers and mothers didn't talk to us about what our bodies were going through. So I wanted to write something that was a nice little easy read. It's got some little funny, little jokes in there, so that it's something that you can understand and relate to. And then once you read it, then maybe you can share with a friend, etc.
I love that. Okay, I feel like it makes a great gift.
Yes, it does. Christmas is coming.
I can guarantee no one else has
It's
put
gonna get
this
it right.
under the tree. Okay, it's a great little secret Santa
It
too.
is.
I like this. I like where we're going with this. When it comes to the older women, you mentioned everybody needs to be aware of these different changes.
Right.
Is there anything like overall that you've seen with the older women, with them having to, I guess, deal with a change that they didn't expect?
I think the biggest thing is that they're suffering in silence because they don't know that there is help. And a lot of that was, for so many years, we focused on fertility and babies, and we never went further than that. And now that we have more medicine and research and supplements that we can use, I think if you speak up about it, then you're more likely to get the help that you need and feel like a person again.
Yeah. Now, I like that you pointed out there are different medicines. It seems like that landscape is always changing
Yes.
when it comes to prescriptions and things like that.
Yeah.
do you see like the natural paths, the
Yes.
the supplements? Do you see that changing as well, those recommendations, or are those typically like tried and true? We pretty much always recommend taking this supplement or eating these foods.
I do think that it is changing, and I think a lot of it has to do with the food that we're eating. So we're having to adapt to how things are changing as far as what we're putting in our bodies. But I like when a patient comes to me that they have more options than just Western medication, because not everybody wants to take, you know, pills or whatever. Maybe they want to do a supplement or a tea or something like that. So I make sure that they have all of their options to choose from.
I love that. We love the options. Where can we get the book?
You can find it on Amazon. I'm so excited.
Yes,
I
I'm
literally
excited
can't wait.
too.
Now the release date is going to be November 6th. So we're going to do a little party and, you know, have a good time. Have some wine or something.
Hey, yeah. Party, bring it out here. Okay, all right. Let's continue to celebrate, but we're going to take a quick commercial break, and we'll be right back with more. We want to thank you for watching this episode of Chattin' with Chelsea. Ladies, do you have some final thoughts? I'll start with you, Dr. Brandy.
Yes. So my final thought would be knowledge is power. So we need to inform ourselves. There are many resources out there. I am a resource, but I think we need to make this topic not so taboo. So find out, get information, talk about it. Don't suffer in silence. We are no longer suffering in silence.
Yes, beautiful. Latrice.
I think I would say for you to pay attention to your body and to listen to her down there.
Oh, yes, because she can be really loud
Yes,
sometimes.
she is loud.
Okay, yes, open your ears. All right, guys, keep up with us on social at Chelsea Show Fox. Thanks again for watching. We'll see you on the next Chattin' with Chelsea.
Thank you, ladies.